Fertile Minds is a podcast brought to you by Vigorous Health, who have more than 40 fertility clinics globally and in Australia, including Melbourne IVF, IVF Australia, Queensland Fertility Group and Tas IVF. Our goal is to demystify fertility and assist you to get pregnant faster. Over the coming episodes, we'll be sharing helpful tips and evidence-based advice around key fertility topics. So be sure to browse our episodes and subscribe so you don't miss a thing. You can also watch videos of these recordings on our Fertile Minds YouTube channel. Let's dive into today's episode. Welcome to Fertile Minds. I'm Dr. Kath Whitton. I'm a fertility specialist here in Sydney at IVF Australia. And today I'm joined by Luke Kane, who is founder of MTPHealth. He is an exercise physiology provider based here at the North Shore Health Hub in Sydney. Welcome.
Thanks for having me.
That's all right. Can you just start off by telling me what an exercise physiologist is?
Yeah, it's a great question. It's definitely one that gets asked a lot between physio and exercise physiology. But fundamentally, exercise physiologists specialize in the later stages of exercise, either for rehabilitation or for preventative health, for people that have clinical considerations to what they're doing. So if you fell over and sprained your ankle, you would go to the physio, and the physio would treat that pain. If after 3 months you were still having problems with your ankle, an exercise physiologist would be a great person to see to take you to that next step.
And so I guess why I love this topic of the impact of exercise upon fertility and pregnancy is because I get asked almost every day by every single patient, what should I be doing? How should I modify what I am doing? Mm-hmm. So can you just briefly cover what it is that you can provide and what sort of services you might offer to somebody looking to conceive or maybe in early pregnancy?
Yeah, well, without trying to step on the toes of other professions, I think the key difference is that depth of understanding of the physiological implications of any presentation, and then the exercise application to help facilitate the goal or the objective that they're aiming for. So for somebody in this circumstance, understanding the implications of exercise and different levels of intensity, their history of exercise and how they their adaptation expectations allows the exercise physiologist to come up with a really structured, systematic plan to be able to step them through their progression to be able to optimize what they're optimizing for, rather than exercising. I used to usually use the analogy that it's easy to make exercise hard.
Yeah.
It's hard to make exercise demanding enough to create the response you need without it being too much or too little.
Yeah.
And so that's where the exercise physiologists have that expertise to be able to find that sweet spot to get the best results for the patient.
Yeah.
Yeah.
So would you be developing a program with an end goal in sight for a woman looking to conceive, for instance?
Yeah, well, I mean, the end goal is pretty defined by them wanting to conceive. But usually what the case is people's first objective is the obvious thing. So conception is the goal. And usually what will not be considered is then, well, what happens then?
Yeah.
And that's also sort of bringing attention to that, to be like, well, this is what we need to do to get you to optimize your opportunity for conception.
Yep.
Then what happens once you've conceived? Then there's a whole nother process that you're going to go through and sort of making sure that you can be adjusting the course as it happens. But yet creating a structured plan that fits with somebody's life and their objectives and their availability. And, you need to be able to do the thing to get the result. And so setting some unattainable target of frequency it's not helpful to the person, to the woman. So making sure that it fits and optimizing what they're doing to get the best results with the time they have is what we'd be doing for sure.
Yeah.
And whether it's a mixture of modalities, it depends on what the person's been doing, what they're used to doing, what they're able to do, injury history, all of that sort of stuff would have to be factored in.
Yeah, so that's it, right? So I guess I see women of all ages, all body mass indexes, all experience, in exercise or, in activity. So I guess, as part of a fertility workup, when I'm seeing a woman, and we can't forget the men as well. We have to, men can exercise to help their fertility as well. And I think we'll briefly talk about that in a minute. But, part of my history taking is really asking them their activity level, what they do, what they like to do. And it ranges from not much, to walking the dog every day, to like elite athletes who come and see me who are trying to conceive. So I guess it's meeting them where they're at and to attain that end goal.
How does their level of activity history affect what you prescribe? Or
So look, I guess my advice often is quite general to people, and we're taught in medical school and in our training for obstetrics, gynecology, and even my fertility training to suggest a woman see an exercise physiologist if she is trying to conceive and is having difficulties, be it because she's not ovulating, she's not having regular cycles, or she's overweight. So my advice is largely quite general, and I will just explain to her and try and educate her the benefits of exercise. So certainly if she is somebody that's not partaking in much physical activity or exercise, it would just be letting her know the benefits of that thing. And beyond the physical, like improvements in cardiovascular and respiratory health and regulating cycles, maintaining healthy weight range, that sort of stuff, all the stuff that we know about that can help with fertility and help prepare her body for pregnancy. We've also got to think about the mental health and the stress, so the mental health side of things, obviously, and the stress reduction that comes with exercise. Great benefits. And I guess for men, so we've got to remember that the man's involved with fertility as well. And we do know that, being overweight, particularly for men, has sort of a belly or, abdominal fat that overhangs the groin and or the thighs might be big, and there's just increased heating around the groin area that can be associated with abnormalities in sperm production and sperm parameters. So certainly maintaining a healthy weight range and being healthy for men is really important in that process as well.
Yeah, I mean, it's from a really rudimentary perspective, something that I would often talk to men and women about is that in any part of life, a healthy, nourished environment is how things grow. If the soil's bad, plants don't tend to grow very well. And so being in the healthiest possible state is always going to. But obviously there's a big range there, right? Like people, when I first started MTPHealth, it was attached to CrossFit gyms. And so very obsessive, high-intensity exercise participants in that. And so they would have different struggles with conception or with, adjusting their exercise to somebody who was completely sedentary and having to adjust their exercise in the other direction to create a healthy environment. So it's that sort of stress balance, finding the happy middle for people.
Definitely.
Yeah. It sounds like we're doing on the same page with it, which is great.
Yeah, absolutely. Absolutely.
Awesome.
Well, I think that's a good point. Like, that's a special area of interest of mine. I came from a really sporting background. I was an elite cyclist as a kid. And my kids now are really, they're really good athletes. And so we're quite involved a lot in sport and nutrition and talking about the body and optimizing health, that kind of stuff. And I definitely see patients trying to conceive in that space as well. And so I guess we've got to acknowledge things like, Red S is a big buzzword, I guess, at the moment. And so there are a lot of people that, or a lot of listeners that might be aware of it. So it's relative energy deficiency in sport. And so if a woman in particular is underfueling and maybe over-exercising, but more about the underfueling, there's certain body systems that aren't going to work properly. And I guess one of the first ones that can be affected is your reproductive system. So I do see women who come to me and they haven't had a period in a while, and they're quite slim and they might be exercising a lot. And so it's really just educating those women about the importance of fueling. Do you see people, I guess coming from a CrossFit background, potentially you've probably seen that?
Absolutely. Yeah. I mean, I think it's helping people adjust the objective, of their training. So instead of it being about how lean can I get, how much can I lift, how fast can I run, the primary objective has changed. And so there needs to be an adjustment in how you're fueling yourself, resting, training, all that. With people that are obviously overdoing it and sort of Red S, there's a lot of nutrition element in that, and there's a lot of, I guess, preconceived ideas of what societal pressures and stuff that feed into that as well, which is always challenging. But absolutely, helping people. I used to use the analogy all the time of you either need to help people find the handbrake, or help people take the handbrake off.
Yeah.
Where's the accelerator, where's the handbrake, and different people will need a different approach. And the athletic population that are used to that push, everything's as hard as it can be. It's finding the handbrake to give themselves, and sometimes that's nutrition, sometimes it's rest volume, sometimes it's training volume or intensity, which is complicated, obviously, with it being such a relative concept for different people. In high intensity will mean different things. But sort of picking through those factors is usually the key.
There is some evidence to suggest as well that, and it probably goes along the lines of red S and women who partake in a lot of vigorous exercise, particularly women of normal weight range, who do partake in regular vigorous exercise. There is evidence to suggest that they do have a lower rate of fertility as women who don't partake in a lot of sort of vigorous exercise. So I think that probably is concerning to a lot of people. But I think that the reassuring thing is that, as we've just mentioned, increasing caloric intake, reducing that underfueling aspect, it can reverse those impacts that vigorous exercise might have on fertility.
Do you get women coming to you regularly with those concerns?
Not regularly. Not regularly, but I have, and it's women who come to me, they'll come to me for one of two things. I'm a gynecologist as well, so they'll come to me for cycle irregularity, or they'll come to me because they're trying to conceive and that they're having difficulty. And not often, but sometimes I do see women who have hypothalamic amenorrhea. So essentially, it's a consequence of red S or low energy availability. So it's just really trying to talk to them about increasing their intake, reducing their vigorous exercise if they can, but obviously engaging in sort of multidisciplinary care, so referring them on to either an exercise physiologist or a dietitian as well.
Gotcha. Yeah, it's an interesting subject because vigorous exercise it's such a broad term, right? So we often use looking for measuring sticks for what is vigorous, and so if you're very, very fit, what someone will deem vigorous, or the calculation for vigorous based on heart rate or based on will vary wildly for people, right? So it's sort of that relative intensity that looking for, whereas somebody's used to training at a 9 out of 10 all of the time, bringing that person down to a 7 out of 10 is taking the edge off. It's really probably no longer vigorous. It's more in that sort of moderate intensity bucket. But someone who's sedentary, that the most they've done in a while is a 3. Them jumping up or pushing into anything near a 7 is going to be way too much. So I think that, going back to the history, it's such a big plays such a big role in setting the benchmark for those people, so that they are moving in the right direction one way or the other.
Do you think individually we have our own sweet spot, or do you think that we've all got the capacity to train to reach a certain level to?
Oh no, everybody's got their own sweet spot.
Yeah, right.
It's my opinion for sure. I think because it's perceived, really. Like you can, and some people won't know what that is because they've never gone to the next step of demand to realize their potential, to know what they are capable of. And that's okay, but it means that every person is going to have a different experience of what they're comfortable with or what they're not comfortable with. And so that's why the tailored approach is so important for people. And using something that's a physiological marker, which makes a lot of sense in a lot of cases, like heart rate, for instance, doesn't really work for a lot of people, in my experience, because somebody who's comfortable with getting their heart rate up to at their absolute maximum all the time is going to feel like they're being held too much back by sitting at 60%, whereas somebody who never gets a heart rate up is going to feel like they're being thrown off a cliff to go to 60%. So using that rating of perceived exertion or their perceived effort or intensity is a much safer way to stack the demands. And the best exercise is the done exercise, right? So if somebody's not going to do it because it's too demanding or challenges too many beliefs, then it's not worth. And they're not going to get any benefit out of it. Right? I had a really, really interesting experience years ago with a young woman who was coming in to see me prior to trying to conceive, and she'd had some difficulties conceiving and had some losses. along the way. And the first thing that happened, which is something I wanted to ask you, is that as soon as she had a negative experience, and we dialed the intensity down and we managed the volume that she was training, but as soon as the first negative experience hit, there was an overwhelming reaction from this woman to want to throw everything out that was a possible variable that could have put her in a negative situation.
Yeah.
And exercise was the first thing that she was concerned about, right? Because she was like, well, I had this loss, so I don't want that to happen again. What am I responsible for? This must be a thing. And we had to work through that a lot to help sort of get her in a position to be able to go, well, staying strong and capable and in a sensible range through the pregnancy, if it happens again, is also important, So do you find, I guess my question is, do you find a lot of people coming in with history of experiences that they also are working through?
Yeah, absolutely. And that's a really common thing that I see. Women who do have miscarriages, the first thing they want to do is ask themselves and reflect and think, God, what did I do? What could I have done to prevent that? And in 99.99% of the case, there is nothing that she could have done to prevent that from happening. So it's just an unfortunate aspect of nature, unfortunately. But
do you think the intensity of their lifestyle factors, if they are a healthy patient or female, that the exercise intensity could be a factor in those sort of losses or fertility issues?
No, not. It's definitely not associated with an increased risk of miscarriage or anything. It's funny that you mentioned that, actually, because I work in an IVF clinic, obviously, in IVF Australia, and it's something that women ask about all the time after their embryo transfer. What can I do? Can I exercise today? Can I exercise tomorrow? That sort of thing. And largely it's absolutely fine. It just depends what they want to do. I always say to them, don't go and run a marathon after this. Don't go and do a HIIT class, maybe like something really, really high impact. But, going for a walk, maybe, something sort of easy that day is okay.
Yeah.
Then I also like say to them, if you are somebody that, like, if this was a negative test in 10 days time and you have your pregnancy test, if you were to have a negative test and you were to reflect and think, far out, I wish I hadn't have done that particular thing that day of the transfer or that day after the transfer, you're someone that's going to blame yourself and wonder, then maybe don't do it. Like, you can wait 10 days.
Yeah. It's great advice.
Yeah. That's lots of things. People will say, we want to go overseas next week. Do you think it's fine? I'm like, if you can wait a week, if you can wait until you've got the test result, that's probably the best thing. Don't add anything into that waiting time that you might reflect back and think, oh, that could be a reason why I didn't get that positive pregnancy test.
And what about for the overweight or obese sort of category of people? That are considerations for their fertility? Your recommendations for weight loss or how they approach that?
Yeah.
How do they vary?
So I'll often, again, ask them what they like to partake in, what they are currently doing, and always educating and providing advice as to maintaining a healthy weight range is the best possible thing. It's only going to improve, your cycles, your hormones, the uterine environment, because we do know that obesity, it can sort of cause an inflammatory response throughout the body. So we just want to reduce all kinds of inflammation, throughout the pelvis, in the uterus, that sort of thing. So it's only going to be beneficial for trying to conceive. And I'll certainly recommend, seeing an exercise physiologist and or a dietitian or a nutritionist to help with that.
Yeah, it's funny. Like I've always had a interesting relationship with the weight loss associated with exercise because I've always taken the approach that it's like talking to someone who's a smoker, in a sense, that tried to quit smoking. They've been told so many times over that it's going to be beneficial, that focusing on that from the exercise perspective is really helpful for their progress. Because typically what will happen as a byproduct of stacking the wins is focusing on their function or their frequency or getting some high fives about doing more than they've done before. And doing it in a way that's sustainable, then leads to another healthy action and another health conversation. And the next day, people end up then coming in saying, what else can I do to move this needle faster?
Yeah.
But starting on the front foot from the exercise perspective is always, I've always been a little bit tentative to do that.
Yeah. I guess I shouldn't have used that in the same breath. Should I assumed that by talking about exercise, we were talking and obesity or overweight, we were talking about weight loss? But it's not necessarily all about that. We do know, that there are additional benefits to exercise in addition to maintaining a healthy weight range or weight loss. Things like improving insulin resistance and improving hormone balance, really.
Yeah. Well, I guess it's from an exercise physiology perspective, you can't out-exercise nutritional problems. Not, and especially not when the goal is fertility, because then you're going to have to raise the intensity and the frequency so high to offset poor nutritional habits that you're doing. It's a double negative, as opposed to the nutrition side being the focus for positive change towards weight loss, and the exercise side being a support mechanism for that, and building effectively their exercise response and their stress response. Because I've sort of taken the approach that if somebody has a stressed environment, whether they're a high intensity exerciser or they're someone trying to lose weight, then sort of cortisol response to that. And if they're not regular exercisers, they're not going to have that quick reduction in heart rate and the reduction in cortisol levels. So it tends to be a sustained stress environment afterwards as well. And it's a lot for people, right? So picking of nutrition and exercise, picking which one is going to be the most effective for which purpose has sort of been the message that I would tend to get to people. Focus on function for exercise, focus on, healthy eating. And if there's a weight loss goal in mind, that's going to come by nutrition. Has seemed to have been really just framing up, because if with an exercise physiologist, we can give general advice on nutrition, healthy eating, pyramid, all that sort of stuff, but that's it. And it's not clinical, advice by any stretch. It's the dietitian's realm. But if somebody's trying to have if the weight loss is the goal, to assist with reducing their risk associated with fertility, and they're on a shorter timeline, they're going to have a more aggressive nutritional requirement, which is going to change what they should be doing exercise-wise. So if if they're in a position where they're just in a holding pattern nutritionally because they have a balanced, healthy diet, then they can. Whereas if somebody has goals that aren't related to weight loss, then they're in more of a healthy holding pattern with their weight management, then they can be a little bit more aggressive with their exercise, obviously still keeping it high intensity, but they can challenge that a little bit more and be a little bit more of a holding pattern with their nutrition. So it's really in circumstance dependent.
So aiming for more strength.
More strength. I mean, strength is the ideal for most people. From my perspective, I'd love to hear your position on that actually, but because once somebody's already active and fit and does a lot of aerobic exercise, it's hard to maintain that while you're also trying to bring down the intensity or bring down but you can, it's much easier to vary the intensity and the demands of weight training because the rest periods can be adjusted, the load can be adjusted. When it's running or it's cycling or it's just effort on a sustained basis, and you can put in less effort or more effort. So it's much harder to manage. So you can definitely, with strength training, be more specific in terms of the changes of output based on the goal.
Thank you. Thanks so much for joining us today.
No problem.
And thank you so much for listening today. We hope you found our episode really helpful as you embark on your fertility journey. Luke, thanks for joining me. Where can people connect with you?
Yeah, well, they can check us out on Instagram, at MTPHealth. We use that handle for Facebook, Instagram, or they can have a look at our website, mtphealth.com.au.
Beautiful. And you can follow me on Instagram at Dr. Kath Whitton, or visit my website, www.drkathwhitton.com.au. Similarly, you can follow the IVF Australia Instagram page as well. For all things fertility, subscribe now on Apple Podcasts, Spotify, or YouTube.